Hello, this is Beth here from International RN, and today we're going to talk about the administration of suppository station for your OSCE exam. So you may have this as one of your 4 skill stations. So this is a 10-minute station. Obviously for this you're not going to have actual patient, it's going to be a mannequin, so it'll probably be just like a lower half, like the bottom. Okay, and as with all of your other stations, I am going to recommend you learn the marking criteria, as that's the best guide for you passing this station. I will put it up on the screen, but please go onto your exam centre website and read it again so you learn it. Okay, so let's go through it. So if first, introduce yourself, explains the procedure and gains consent. So hello, my name's Beth, I'm the nurse looking after you today. I'm going to give you a suppository. Is that all right? Yeah, fine. Normal things. Okay, then obviously you're going to check your drug chart. So it's quite a straightforward drug chart, you know, there's not going to be too much on there. So please read out to your examiner what it is you're checking. So you're going to ask the patient, obviously you're going to ID them, so you're going to ask them to state their name and date of birth, and you're going to cross-check that, and then you're going to check the hospital number from the patient's wristband. Obviously you're checking that the prescription is legible, it's the correct prescription, so like glycerin suppository, and the doctor signed it. And just tell your examiner as you're reading through that you've checked all this. So I can see this prescription is signed by Dr. Jones. It is due today at 4 o'clock. It's today at 4 o'clock. I'm happy to give it. Allergies also, I can see the patient is allergic to penicillin. This doesn't contain penicillin, so I'm happy to proceed. All of those same things that you would have done in your medication station. Okay, the next part. Wear gloves and apron. I think that's pretty straightforward. Verbalizes that you would request the patient to lie on their left side with knees flexed, feet level or slightly raised, buttocks near the edge of the bed. So the mannequin should already be placed like this. They're not going to ask you to move them at all, so it should already all be there. If it's not, your examiner will move it. Okay, that's very unlikely to happen, but you just go through those things I've just explained, so it shows you know how to position the patient correctly, and that is part of your marking criteria. And then here, the next step on the marking criteria is the prescription check, which we've already done. So I would go ahead and assemble all of your equipment now. And then before you go back to administer the suppository, I would always advise doing a second ID check with all medications in your OSCE. This is not 100% necessary, I'll be honest with you, but you're going to be stressed and you're likely to forget one of the ID checks. That's why I always encourage my students to do 2. And, you know, with this method that we've been implementing here of always doing 2 ID checks, we have been having a lot less failures due to that. Okay, so before you give the suppository, obviously you're going to check the expiry date and check that it matches the prescription. Pretty straightforward and standard with all your medications. So other things you need to do, so you need to explain to the examiner that you're going to check the patient's skin and what it is you're looking for. Okay, so I'm going to tell you what to say. Again, this is on your marking criteria and you do need to learn this. So prior to inserting suppository, verbalizes that they are observing the anal areas for evidence of soreness, excoriation, swelling, hemorrhoids, rectal prolapse or infestation. Okay, so the next stage is obviously actually giving the suppository. Obviously tell your patient and maintain a good conversation with them throughout explaining what you're doing. Again, this might be, as with your other stations, slightly different to how you actually do it in practice. So what they advise you to do for the exam is place some lubricating gel, so your lubricant, onto a gauze square and lubricates the suppository, separating the patient's buttocks and inserting the suppository using the correct end, so that's a pointed end, and advancing approximately 2 to 4 centimeters. So obviously you're going to put in the mannequin and just explain to the examiner that you are advancing at 2 to 4 centimeters and so on, because obviously they can't see that. Okay, afterwards you're going to clean the patient with your gauze, again always verbalizing it. Okay, final steps, obviously your discussion with your patient. So verbalize, you would advise the patient to lie down for 20 minutes or until they can no longer do so, and inform them there may be some discharge as the medication melts. So just have a chat with them. I've done your suppository now. Can you please lie down for 20 minutes, let it work? There might be a little bit of discharge, but don't worry about, I can clean you up. Also verbalizes that you would assist the patient into a comfortable position and offer the bedpan or commode as appropriate. Okay, so obviously that's the general chat we're going to have with a patient. Are you comfortable? Just give me a ring if you need a hand to the toilet, but please try and wait 20 minutes and I can help you with the commode or anything. Okay, just the general things we would be saying anyway. After this, obviously remove your gloves and apron and gel your hands, and then remember to do your drug chart to sign it that you've done it. Before you enter the station, as well, I know this is pretty obvious, but people forget, make sure your patient's covered, ideally before you take off your gloves and apron. And then before the end of your station, if you do have extra time, I would always advise just take a moment and try and relax yourself and then run through in your mind, have I done everything for this station? I have 2 minutes left. If I've realised I forgot to sign my drug chart, I can go back. If I forgot to ID my patient, I can tell the examiner and ID them quickly. If you do these things, they are likely to still pass you. So don't waste any of your time by asking the examiner to finish your station early unless you're 100% sure. Now, if you are resitting this station or would like help with your full OSCE exam, please feel free to contact me on International RN. You can send me a message via Facebook or Instagram, and I'll be more than happy to contact you with the dates for our next training course. Good luck with your exam.